invite Dr. Shazia Maqbool. She's experienced pediatrician with a medical degree and an MD in pediatric medicine, as well as certificates in various pediatric specialties. Skilled in general pediatrician, developmental behavior pediatrician, and preventive pediatrics. She's specialized in early childhood development and autism spectrum disorder, and created Shamak developmental screening tool. I would like to, Madam, to take floor. Thank you.
When I was given this talk by Khatija, I said she attended this workshop conducted by UNICEF a couple of weeks ago and said, Madam, can you present that one? And I said, fine, I'll do that one because that was an easier task. एक तो काम ये करें कि जो मोबाइल फ़ोन से अपने साइड पे रख दें. Because if we want to be role models for our patients, for our parents, for our children, then we first have to make sure that when we are amongst people whom we want to listen to, we also make sure that our mobile phones are on the side. Am I right? Agreed? Okay. Thank you for listening. Early child development or child development both are affected by what we call things which are world disasters, like floods happened in Pakistan, unfortunately, this year, earthquakes, which happened in Turkey and Syria just a couple of months ago, and then there are disasters which are man-made. When I say man-made disasters, these are wars. And when we talk about wars, the most affected are children who are left behind, both development-wise, being orphan-wise, and emotional, whatever you call it. These children, when grow up without any love of their loved ones who are gone due to these effects, are the ones we are kind of, I think we are responsible. I'm not talking about only us sitting here, but as human mankind. And I think this is where development should start, that we stop these things, those who are created by us. So when early child development comes, identification of delays and what to do with them comes as well. You have since morning been listening to what is early child development. Before I start on that, I'd like to say that I have no financial interest or other conflicts of interest related to this presentation. And what I'd like you to take away is that, yes, we talk just a little bit about early child development, and why is it a silent pandemic, and what are the risk factors? Why should we be identifying these risk factors and working on them early? Like Sabah used a very interesting word, I thought, early investment. So everything early is important in our lives. Early marriages, for that matter, are not important, but timely ones are important. So talk about early intervention. And while we are doing that, I'll talk about what we did while I'm working at the Children's Hospital, a Shamak construction tool, developmental tool, which was constructed on the indigenous population, because all the rest we thought we could not work with on children young as 2 months. So yes, it refers to, if I want to tell you in very, very simple words, this is many skills or milestones which children should be achieving but don't achieve. As simple as that. This is early child development. Some people say up to 3 years, some 5 years. This morning you heard 8 years. Actually, it is 8 years. 0 to 8 years is the term which we used to say early child care and development, ECD, coined first time in UK. And the reason they used care and development was that everybody has to be involved, like you heard our UNICEF representative say this morning, and this is very correct. And it has to be that way, because it's influenced by not only the child, him or herself, but by the family, by the whole pind, by the way. The whole village is involved. Nani, Dadi, their friends, everybody is involved in child development and have to be taken into consideration, whatever advice they give. And it was back in 1970s when people started talking about, what is this? Why are children delayed? What's happening? And that's when they started talking about different domains of development. This was again for the ease. You can never separate motor development from visual development, from cognitive development, from speech development. They're all interlinked. But yet again, for ease, like we say, this is our arm, this is our eyes, this is our hearing, this is our speech, we have to divide them into these 4 or 5 groups accordingly. And the reason we divide them is so we can say, well, this is an isolated speech delay, which means बस सिर्फ speech का problem है, or it is more than 2 developmental areas, so we call them global developmental delay. So that is why, for purpose of definitions and for purpose of telling people what's wrong where, for telling parents what's wrong where, we divide them. You heard this morning from a UNICEF person who was giving a visual lecture. This is the most important thing, synaptogenesis. 40,000 new synapses per second. Can you believe that? This is like looking at your mobile and taking your mind off. That is how quick they develop in the early years. And this is approximately completed by 2 years. And this pruning process then by late adolescence is completed. Though the development, as you can see in this slide, starts much before. Again, you heard this morning. And I'll share with you, Ms. Mehnaz was just, our Honorable Minister for Child Rights was just mentioning what happens about experiences. And I shared that experience with a group from workshop as well, that when my first child was born in UK, I used to like what was called Neighbours, an Australian program. And it had a very sweet melody to it, Neighbours and all that. And I realized that when Shahira was born, a few weeks after, while she was crying, I put that on to just see it, that TV program, and she just stopped crying. And I witnessed that. So personally also I think this, whatever people say, that when we are talking to your child and your mother is in good health, this is what happens. You get a good developing child. So why do I call it silent pandemic, and why do world over people are saying it is a silent pandemic, the worst ever? We have seen COVID, the worst ever. But then, now we are sitting in a group, people may be having some cold, but we are not frightened. Before, like a year and a half ago, we said, oh, this could be COVID. Now we don't do that. The reason being that we have overcome it in a way that it's now less lethal. We have vaccinations and so forth. We have precautions. Why couldn't we work on this particular issue? And we are trying, but like Sayyid Jalal just said, are we trying enough? Are we just talking a lot? That's everybody has to see. I'm not going to go through the whole list, but in the last, when I say lack of stimulation and education, that's what ECD is. And that's what so many organizations you see on the top are doing their best, but even that's not enough. They are doing their best, but we all have to work, join hands and work together, not work in silos. And I congratulate Khatija, Dr. Saba, Antone, everybody from different fields, Mr. Nazir, who was just sitting here, that coming together, Mr. Rafiq, this is what we need. People from education, people from health, people from everybody, and above all, a person like Ms. Mehnaz, who herself I know has been working. So I have 5 minutes left, and I have the whole presentation to go. So burden of disease, you all know that. I'm not going to go through that, but it is nearly 15% as if now it is predicted. In the last census, disability was not properly represented, and we hope that it will be done this time. Early referral of children at risk is important because we need to make sure that screening checklist is administered, refer children with sign of any atypical development, and early identification is done to improve outcomes. Many people say, why can't we do developmental surveillance? Developmental surveillance is taking one child and following the child through. If I ask, if you are there, mothers and fathers sitting there, how many of you go to the same doctor year after year? You don't. That is why surveillance does not fit the bill in Pakistan. We need to do screening, which is like snapshot. And that opportunistic screening will take a child, whoever comes, and you apply that test. So this is a snapshot way to see if a child is growing properly. It can be done by many other professionals. It doesn't have to be a doctor always. And systems of surveillance are too specialized, by the way. So one has to make sure that we make these attempts to do developmental screening. That is why Shamak came into being. I'll quickly go through it. Why was there a need to develop it? Because in normal children, parents don't know whether the child is growing normally or typically. So when you pick that up and tell them, they say, Acha, or even the pediatricians or even the primary care physicians, parents pick it up and take the child. जी 2 साल का हो गया चलता नहीं कोई नहीं चल पड़ेगा 2 साल का हो गया बोलता नहीं कोई नहीं बोल पड़ेगा. That's where you are needed as ECDs. इससे बहुत पहले you were needed. Parents say नहीं बोल रहा ये इधर ये करना था आप कैसे कह रहे हैं. So this is where these kinds of things are important. It was tested, is about to be published, and we picked up nearly 10% delay at all age levels. And that is where we thought that if we do not work on this together, we end up having more delays. Like at the age of 3 years, we had 10.5, but before that we had 23% delay in children who were 18 to 24 months old. And both males and females were affected. This is more like internal consistency, agreement. And then we applied this on 12,000 more children and found again that 9.9% had delay of one kind or the other. It did not pick up the exact delay, but it told us that this child needed early intervention. And that is why research is very important. So components of early intervention, many people might talk, but it's the same as what the domains are, and you work on all domains together. How can you tell one hand not to work with other hand? How can you tell eyes not to see while you're walking? So everything is involved. Speaking. So you'll find many times that a child who's visually impaired maybe is not that good in speaking. Why do you think is that? Why do you think that could happen? Because he's not putting in too much in his mind. But sometimes they're very bright because they're hearing. They're speaking very well, but they may not be seeing, but their hearing and speech is great. So advantages is, I'm just going to talk about one thing, and that is that children reach their full potential. That is what early intervention does. And we do not have behavior problems in those children. Parents are supported well. If we are doing ECD, they know where to go, how to talk to, if they have somebody to talk to. So this is why early intervention involving everybody, including health people, is important. And the University of Child Health Sciences, Children's Hospital Lahore, inshallah, will soon have a conference there by the department. This was in 1998 when it was first made professorial unit hai ye. And then we have all this what's going on. I'm not going to go into details, but I'll just tell you, this is one unit in Lahore one in Faisalabad, one in Multan, and hopefully in AIOU, one coming up soon, already working, Dr. Sidra is there. But 47,000 children only in 2022, just in one outdoor of developmental and behavior pediatrics, 250 patients a day. This in itself gives you a big data why ECD is important and what could we have prevented, which has now landed in our departments. This is the whole spectrum of disease. I can't emphasize enough why this is not just one problem. It's the whole spectrum, and the whole spectrum has to be looked into. Speech disorders, GDD, learning disorders, CP, autism spectrum and other disorders, ward. Breakup in itself, hamara jo tha, wo, you can see ID, CP made the big chunk, lekin autism ne jitna big chunk banaya hai, we have the biggest data there, who are true autism selected children, and 9% hai agar aap saron ko le lein. So one window model में अगर आप ये देखें कि what are we doing, है एक मिनट, अच्छा, one window model का मतलब क्या था? When I came from UK, we used to send to clinical psychologists and sit. 2 months के बाद result आ रहे हैं. We used to send to special needs, speech and language pathologists and sit, wait. 6 to 7 months it used to take. When I came back, I said, no, we are all going to sit under one roof and work together. Bachcha yahan se jaye, because we have patients who come straight away in the room. Koi appointment system nahi hai abhi tak hamare paas. Aur usme what do? You bring them in, make your teams, and they go through the flow, chahe jitna bhi kaam ho jaye us din, but everybody is sitting under one roof, and that is what one window model is. That was introduced for the first time in the University of Child Health Sciences, Lahore. और इसका मतलब क्या था? इसका मतलब यह था कि हम हर वो काम करें जो कि लोग तब तक नहीं कर पाए थे और मुख्तलिफ जगहों पे काम कर रहे थे. मल्टीडिसिप्लिनरी अप्रोच का कुछ इतना पता नहीं था. I'm talking about 1999 by the way. तो लोग हैरान होते थे, and then everybody started following steps. Allied health professionals, doctors, शीरो शक्कर हो गए, अच्छे तरीके से काम करने लगे, and mashallah, the department in itself has grown up to be 100 staff right now. अल्लाह का शुक्र है. So salient features में हम ये सब काम कर रहे हैं, मगर एक काम जो मैंने UNICEF workshop में भी कहा, ECD outreach, and we need help there. वो अभी तक हम उतना अच्छा नहीं कर रहे जितना हम कर सकते, जितनी हमारे पास टेक्निकल एक्सपर्टीज़ है. तो आई रियली रिक्वेस्ट एवरीबडी ऑन दिस फोरम, यहाँ पर भी और आप में पार्टिसिपेंट्स में भी, कि हेल्प अस. वी आर हैप्पी टू प्रोवाइड टेक्निकल हेल्प, बट वी नीड फाइनेंशियली कि हमें लॉजिस्टिक्स हो जाएं कि कहाँ करना है, किस एरिया में करना है, एंड वील जस्ट गो एंड डू इट विद यू गाइज. ये हमारी डायग्नोस्टिक टीम है. And then there is therapeutic team A, B, C of different disorders. Speech therapy hai, occupational therapy hai, sensory therapy hai, autism and behavior disorder center hai, first of its kind within the public sector. And this is the outreach which we did on a very small scale in our setup. Cochlear implant is going on in our setup since 2017. Learning center, again, personal experience, patients who used to come to OPD, we used to train them, send them to normal school, and normal school कहते थे हमने नहीं लेना, ये तो special child है, और नहीं होता था. All they needed at that time was inclusion. Or inclusion में then we included them in learning center within the hospital setting. Again, we had to face a lot of upheaval on that, but so what? It became a very good program, and mashallah now inclusion. There are certain NGOs who are doing it. Amin Maktab hai, Rising Sun hai, there's so many others. They're doing it in Lahore and maybe here also. But again, within the public sector, this was our initiative at that time. Then many other followed. Humaira यहाँ बैठी है, इन्होंने शुरू किया. वहाँ पर होम इकनॉमिक्स में शुरू हुआ, पंजाब यूनिवर्सिटी के क्लिनिकल साइकोलॉजी में शुरू हुआ. पीपल गॉट टू नो कि ये भी एक वन वे ऑफ सेंडिंग चिल्ड्रन टू नॉर्मल स्कूल है. दैट्स डेडिकेटेड इन पेशेंट. Why should we have a department with a ward? ये तो outdoor based services हैं. This is again something, a big opposition we had to face, because our children were the last when they came with acute issues. Children with special needs, they were thrown in the last of the list because ARIs को पहले होता था. So that is why this came. ख़त्म हो गया टाइम. थैंक यू वेरी मच फॉर गिविंग मी एक्स्ट्रा टाइम, एंड आई एम सॉरी इफ़ आई हैव टेकन समबडी एल्सेस टाइम, बट आई थॉट अपनी कहानी इतनी जल्दी, वो आजकल बड़ा अच्छा गाना चल रहा है कहानी सुनो, तो इतनी जल्दी कहानी बताना मुश्किल होता है. तो टेक होम मैसेज के साथ मैं ख़त्म करूँगी कि हमें मैल न्यूट्रिशन को तो काबू पाना है, लेकिन इमोशनल अब्यूज़ को भी काबू पाना है. और हमें सिर्फ पेरेंट को एक सवाल पूछना है, आपका क्या हाल है, आप ठीक हैं? कुछ भी करने से पहले अगर आप ये पूछ लें, माँ पूरी कहानी सुना देगी. सो मेक श्योर दैट वी डू दैट. और पॉजिटिव पेरेंटिंग को भी एंटिसिपेटरी गाइडेंस में अपने डालें. ये नोबेल प्राइज़ एक्चुअली से जो है, उसने कहा कि हम सारा कुछ कर रहे हैं, बट व्हाट वी नीड टू डू इज़ मेक श्योर कि जो हम सारी चीज़ें कहते हैं कल करेंगे, जैसे सैयद साहब कह रहे थे, वो आज करनी, क्योंकि बच्चा आज है. लास्ट जब भी मैं गैदरिंग को देखती हूँ जो ECD पे काम कर रही होती है, हमेशा कुछ ना कुछ दिमाग में शेर वाइज भी आता है. मैं अकेला ही चला था जानिब मंजिल, मगर लोग साथ आते गए और कारवां बनता गया.